Hi, Dr. Garima here again. Finally could manage to somehow do the camera settings. I'm just not a tech person. It was coming so dark in my previous videos, like I'd mentioned. I just switched my PC and yeah, it was giving me this tech issues. Anyways, happy to have that fixed satisfactorily. It's okay. So yeah, today's video is again of course about another SBQ of the Australian Dental Council exam. But I'm not solving a mock today. I am going to solve a concept today. Not solve, rather, I would give a detailed explanation by taking help of other already awesomely made videos on the YouTube, thereby giving credit to them as well. They have done the effort, they should get it. One of the most commonly asked questions, and no matter how many times I have explained it, still the question keeps popping up because probably somewhere still there is some confusion. So if you are already an existing candidate who has watched my videos and you have come across that amazing TMJ video which I just had, a brainwave simplifying the concept. This is not a brainwave for this video, but little more simplification of the same concept. What am I talking about? I'm talking about which pulpal test to do in any given scenario. Okay, because the question usually asked is which is the best test, or which is the initial test, or which is the first test you would do in a patient who comes to you with pain in the tooth, say on the left quadrant or the right quadrant, and the options given to you would be percussion, probing, mobility, pulp vitality test, or instead of pulp vitality test they would have mentioned cold test and periapical x-ray. And everybody feels all the options are correct, so they are so confused as to which test you're supposed to do first, right? Which investigation you're supposed to do first. And then after that, if a cold test and a hot test is also given, they are further confused. Oh my god, which one to do? So let's talk about that. See, what do you mean by a test? I think here the confusion is arising because we have limited ourselves in associating one test with one given pathology and you feel only this is right. No, it's not like that. First of all, what is a test? A test is basically an investigation or an experiment you are conducting, a scientific experiment which has a proven track record rather, to determine what is happening is associated with what problem. Because you know the treatment, but you need to know which treatment to be applied for what problem. And to understand what is the problem, you're doing the test. Basically, a test not only guides you towards a problem, it also rules out other problems. So when it comes to determining which one to do, percussion or the pulp vitality test, when a question comes like a patient came to you with pain in say upper left quadrant, patient had a long lingering night pain and doesn't know which tooth is hurting, and you have like two three teeth with cavities and one a deep cavity, and then you are like, which is the first test that I will do? And many people mark percussion and they ask me why was that test wrong? Wouldn't tapping on the tooth indicate which tooth is the problem? Okay, so here is my very simple answer to you all, and I hope you understand the logic behind it. What is a percussion test? A percussion test is you tapping on the tooth. When you are tapping on the tooth, what area of the tooth are you trying to determine is healthy or not? You are doing that to the periapical area or the lateral periodontal areas. Okay? You are not doing anything on the pulp of the tooth. Periapical areas, if they are traumatized or infected, traumatized how? Either there's a trauma on the tooth is bumped, or something else has happened. Periapical infection can happen due to periodontal reasons. It can happen due to some cystic or fibrous lesions which are happening inside out of the glue. or it can happen because there was a pulpal involvement which went in the periapical area. You understand? So in all these given scenarios, the trauma and the other conditions which I just mentioned, which can happen in the periapical area, when you're going to tap on the tooth, it will give you a response. And if that is a positive response, then there is a periapical pathology. Doesn't mean that it is only a pulpal pathology. There are 5 to 6 different types of periapical pathology that can be, and one of them may not be a pulpal pathology. So just by tapping on the tooth, you cannot say that the pain is because of this tooth if the pain was of pulpal origin. You understand? Now, when you are doing a pulp vitality test, as the name suggests, which can be your heat test, cold test, electrical test, the actual true vitality test, which measure the blood supply of the pulp, like the laser Doppler, etc. You are testing the blood supply and the nerve supply of the pulp. Pulp is a different tissue altogether than from the periapical tissue. The pulp goes and communicates at the apex to the periapical tissues, but the pulp is entirely a different structure on its own. So when there is a carious involvement of the tooth and the patient is having a history of a spontaneous lingering pain, then you are going to check if that tooth is vital or not. You are not checking the periapical status. So if a question is specifically mentioning the patient came with a spontaneous night pain and the picture that is shared on your question is showing a very deep carious lesion, you are supposed to do the first test is to determine whether the pulp is still alive, it is dead, or what is happening to the pulp. Then you will check the periapical status. You got my point? So I hope from now on you will not be confused in percussion and the pulp vitality test. Pulp vitality test is just to see whether the tooth is dead, alive, responding, not responding. Percussion test will check the periapical area to see if there is a periapical involvement or not, and if there is, then you still have to conduct further tests to see why the periapical involvement is there. Is there a history of trauma? Is there a caries on the tooth? Is there a periodontal lesion that is going on? Is there a cystic lesion that is going on? You have to conduct further tests to see the cause of the periapical area problems. You understand? This is the basic difference between the percussion test and the pulp vitality test. Mobility test, when you will do, again, if there is a trauma. In cases of severe trauma, like the patient just had a fall, had a subluxation or fractured the tooth, which is the first test you will do, I will go with a periapical x-ray to see if anything else in the bone is fractured. Then I would do my mobility test to see if the tooth is mobile or not. You understand? Yes, so I will not be doing a pulp vitality test as my first mode of test in a traumatized tooth, because pulp is in a state of shock, it may or may not respond properly to me. So I will not just have full trust on the pulp vitality test in a traumatized tooth because it's in a state of shock, but I will record it as my baseline, but it won't be my first choice. You understand? Because by default pulp was not having a pathology. It was traumatized, and that's why it's in a state of shock. When there is a trauma, it mostly affects the periodontal areas, the alveolar bone areas, the fibers of the periodontium, cementum, etc. Pulp by itself can be exposed, but there was no bacterial pathology happening in the pulp. It was a healthy tooth. Hence, pulp vitality test is of low priority here for me. But my periodontal tests are of more priority here to see how much is the tooth mobile. Do I need to splint it? Is there a periapical fracture that has happened in the bone? Again, required me to splint. If there is a root fracture that has happened, do I need to splint? Do I need to observe? All these things. So you cannot choose pulp vitality test as your first choice if the question is saying the patient just came with a trauma on the front central incisor and there is a fracture of the tooth, which is the first test you will do. And then you will say, doctor, but why have you not chosen the pulp vitality test? The pulp was never a problem, dear. It is the other areas which has happened. This is how you think, and this is how you solve the question, and this is how you become a better clinician in choosing which test to conduct in which order. In your clinical scenario, it doesn't matter in which sequence you follow, because anyways you're doing all the tests. But in your exam, when they are asking you to choose one, that is the time when you get confused. So you remember these concepts, why the patient has come to you, what is the chief complaint, and then you go and do minimum investigations to first diagnose that chief complaint. Then you do all the other tests just for your record purposes. You understand? So I have found a very nice video in this regard, which I will just play now. I want you all to go through this very nicely.
Pulp vitality testing is important for the diagnosis of pulpal diseases. The information that we get from pulpal tests is useful for treatment planning along with the patient's history, clinical examination and radiographic examination. Let's discuss the indications of these tests. Ehrman has proposed 3 key uses of pulp testing before operative procedures. Like for example, when we want to restore a tooth and the health of the pulp of this tooth is in question. Second is for diagnosis of pain. So pulp tests can be used for finding the source of oral pain. It's particularly useful for the diagnosis of pain in the trigeminal area. So basically pulp tests help us to localize the pain. For example, to differentiate pulpal pain from pain that comes from other conditions like myofascial pain dysfunction syndrome or pain that is referred from other areas. Third is for the investigation of radiolucent areas. When we see radiolucency at the apex of a tooth, it could be the result of extension of pulpal pathology in the periradicular area, or it could also be other pathological processes like cysts, fibrous lesions or even neoplastic processes. It could even be a normal structure, for example the mental foramen. So pulp tests help us to identify the reason of the radiolucency. In addition to these, Mumford and Beyond suggested 3 more uses of pulp tests. Post-trauma assessment, that is for checking the vitality of traumatized teeth, teeth involved in jaw fractures, and also vitality of those teeth which were involved in surgery like subapical osteotomy. So to check the vitality of these teeth, pulp tests are useful. Pulp tests can also be used to check if a tooth is completely anesthetized after the injection of local anesthetic before starting the operative procedure on the tooth. Although this is difficult to do in daily practice, this is useful for experimental studies where we want to test the effectiveness of different local anesthetics. And the last indication is to check the vitality of teeth in which pulp capping is done or teeth that have deep restorations. To understand the pulp test, we need to understand how the pulp is innervated. There are 2 types of sensory fibers in the pulp. One is myelinated and the other one is unmyelinated. Myelinated fibers are called as A fibers and unmyelinated are called as C fibers. The pulp is innervated mainly by A fibers, which have 2 types, A beta and A delta. 90% of the A fibers are A delta fibers. The A delta fibers mediate acute sharp pain and the C fibers mediate dull, burning and poorly located pain. The most widely used pulp vitality testers that are being currently used assess the integrity of the A delta fibers. So the stimulus is applied to the outer surface of the tooth. If A delta fibers are stimulated, the patient will report a short, sharp sensation from the tooth, and this indicates that the A delta nerve fibers are functioning.
समाज में छुआछूत के चलते लोग उनके बगल में बैठते नहीं, उनके अगल बगल में आने नहीं देते, उनके हाथ से खाना नहीं खाए.
There are 2 types of tooth vitality tests, neural sensibility test and pulp vascularity test. The neural sensibility tests are most commonly used, but they cannot detect pulpal blood flow and they are dependent on patient's responses and the dentist's interpretations. So pulp vascularity tests are actually true pulp vitality tests because
So I hope this is clear now. I have shot a detailed video on the other forms of pulp vitality test, which is a separate video altogether. So anyways, this was just a concept clearing video, and I hope your concepts about which test to use for what purpose is more clear now after the explanation and the short brief explanation. You can of course go and watch this video on this channel, Taught Well Simplify Ed. Very nice video. At least this video was very nice, and know more about it. So let me know if this helped you in any way, and I always love your comments. So see you all soon. Bye bye.